So if you're wondering how to do an accurate blood pressure reading at home, then by the end of this video, you'll know how to get the best use of one of these machines, also exactly what you need to do before checking your blood pressure, and importantly near the end, we'll cover which arm is best for checking your blood pressure. That seemed like one of those dances. It's not the Macarena, trust me. If you're new here, my name is Dr. Khalid. I'm a family doctor from London. I make evidence-based health videos with a little bit of sprinkling of sarcasm. So let's just dive into it. I'm going to assume you've already got one of these machines. This is a blood pressure monitor. You can get one from a pharmacy or a shop, like the old school things, you know, those things existed, or from Amazon. I'll basically leave a link in the description if you need one, but this is what it looks like. It doesn't have to be this company. You can get it from like any company, and as long as it works, standardized, it's been tested, you're good to go. Okay, so now that that's out of the way, it's important that you wear the right clothing. Like, just look at this. So if you're wearing a hoodie and then you're trying to lift this like a lot of patients do in my consultation, it's not going to work. We'll probably get to like up here and you'll need to take it off. So just best thing is t-shirt, light clothing, no hoodies, and we're good to go. Oh, and it is really important to make sure you've got the right cuff. Now, technically, these things come with like a medium-sized cuff at the beginning. So like when you've opened it, you can buy a larger cuff if you've got a large arm, or a smaller cuff if you've got the arm of a child. And then before you check your blood pressure, make sure you haven't been doing any of these for the last 30 minutes. That is smoking, shouldn't be doing anyway, but please don't do it. Vaping as well. Drinking caffeine, tea, we've got caffeine, FYI. Make sure you haven't been eating, and make sure you haven't been watching Manchester United play football and lose another match, because that definitely puts your blood pressure up. And yes, I say that as a seasoned Man United fan. Basically, doing any of these things can put your blood pressure up and give you inaccurate results. Just don't do it. Now we're on to the very first step. It is your position. Make sure you're not doing a handstand. It seems to be fairly straightforward. Make sure you're sitting in a chair and you're comfortable with your back straight, feet on the ground, not crossed or in some yoga position. Why you would be doing yoga whilst you're doing your blood pressure, I ain't got a clue, but just sitting normally like a human being. Maybe it's a good idea to have a table next to you so you could rest your arm on the table as well. And again, important that you're not clenching your arm. It's not in a weird, awkward position behind your back. Some people may be into that, but probably not for the purposes of blood pressure readings. And then we're going to use the rule of twos in terms of the placement of the cuff. It'll be 2 fingers above the elbow. That's where the lower part of the cuff should be. And once you've tightened the cuff, make sure you can slip 2 fingers underneath the cuff. Some cuffs may have like a downward arrow or a sign that says elbow, middle of the elbow here. Others don't. Just try and get the positioning right. And also just make sure when you've got the tube that's running away from the cuff that you're not putting pressure on it with your elbow, because then it just makes a noise or the machine doesn't work properly. And remember, when you're checking your blood pressure, it's important you don't talk, you're relaxed, and then you press the button, the on button, and then the start button to actually inflate the cuff. Then I like to tell my patients to just close their eyes and pretend they're on a beach. Imagine there's no cost of living crisis, no wars going on, no recession knocking on our door. And you'll feel the cuff inflate quite rapidly. It goes to the highest level and then it comes down. Sometimes that pressure can be a little bit sore. Don't worry, it will come down. If you can't manage that, you can press the stop button. For most of these machines, the stop button is the same as the start button. And once you get that reading, that's your blood pressure reading. Make a note of it. Some blood pressure machines will be linked to an app and be fancy and transfer that data. I'm a bit old school. What can I say? Just write it down on a piece of paper, use a pen, so that when like AI takes over this world, they don't have access to your health records. Also, definitely don't take a photo of that piece of paper and put it on Facebook so that Mr. Zuckerberg can sell off your health data. I normally ask my patients to take 3 readings every time they sit down to take their blood pressure and take the average of those readings. If you don't know how to do that, just write those 3 readings down and make my life a little bit more difficult when you come and visit me. And it's always a good idea if your family doctor asks you to keep a diary of your blood pressure, you do it for about 2 weeks and then you book in to see them again so that you can go through the results. Okay, we're on to some common question. Which arm is best? I'm neither a leftist or a rightist. You basically should check in both arms when you first get the machine and go by the arm that's got the slightly higher reading. So if your right arm's got a slightly higher reading, do all your blood pressure readings on that one. If there is a huge disparity between your left and right arm reading, then maybe see your GP, family doctor. How many times a day should you check your blood pressure? Well, the general aim is not to go crazy. I think 1 or 2 times a day is a reasonable thing to do, especially if your GP asks you to monitor it for a short period of time. I had a patient who checked it 6 times a day for a 2-week period, and their blood pressure was up, and they were anxious, and we were anxious, and I was just like, we don't need to do that. We don't need to get that worked up about it. We need to chill, check them 1 or 2 a day, write those down. And remember, that's only when we are asking you to monitor it closely. Generally speaking, if you're monitoring it routinely, every couple of weeks, every month or 2 is a reasonable thing to do. How long should you be checking it for if we're looking for high blood pressure? Well, a 2-week period gives us a good amount of data to be able to make that judgment. So if you're doing a reading a day or 2 readings a day over a 2-week period, that's a good kind of length of time. Now that you know how to check your blood pressure, the important question is, what do the numbers actually mean? When are they high? When is it dangerously high? When should you see your family doctor immediately? That's on the next video. Click over here and I'll see you on that one.